Hey A&Pers, this is Dr. Jones checking in. This is A&P 1, Lecture Test 2, Video 2. So we're talking about the tissues and we're running through the epithelial tissues. So we are at the very bottom of page 3. We are starting right here with the chart, the bottom of page 3. So we have a picture up and name that tissue. Usually we have this lecture right before the lab tests, so I include this as a bit of a quiz to quiz yourself on how ready you are for the first lab test. Can you identify this tissue? If not, you're behind in lab. Third blank, so you know I'm serious. Okay. So what in the world is that tissue? That is simple squamous epithelium. And so I have a box for you to draw your simple squamous epithelium, and then a box for the functions, and I have the functions on their own bullet, and then the locations, which I also have on their own bullet. So the functions of simple squamous epithelia are absorption, diffusion, secretion, and to reduce friction. The location are the alveoli in the lungs, and those function in diffusion, and also the serous membranes, which reduce friction. So the serous membranes are the pleura, the pericardium, and the peritoneum. Those are the serous membranes. Remember, the inner membrane is the visceral layer, and the outer layer is the parietal layer. Lots of P's. And also the inner lining of the heart and the blood vessels. So two terms at the bottom of page 3 before we turn the page. Mesothelium is the term for serous membranes. So that includes all the serous membranes, pleura, pericardium, peritoneum that we just talked about. The endothelium is the name of the simple squamous epithelium that lines the inside of the heart and blood vessels. And we'll talk more about that briefly next semester when we talk about the heart and blood vessels. Audible page flipping noises. Moving on to page 4. Okay, I've got a keyboard. I can push an arrow button and that will turn the page. ID that tissue. Right, a stratified squamous epithelium. What you may or may not know is there are two types of stratified squamous epithelium, and we need to learn them both. Arrow key. Keratinized and non-keratinized. So keratinized stratified squamous epithelium has a protein in it called keratin, and the keratin kills the cells and dries them out. And so this helps protect against mechanical stress and dehydration. And the location is the skin. Your skin is keratinized stratified squamous epithelium. As such, it helps keep the good stuff, which is, your blood and other liquids, in, and keep the bad stuff, which is viruses and bacteria, out. Unless, of course, you cut your skin and then you have an open avenue for infection, and that's why we keep our open wounds clean and cover them if they're in a location where we can't not touch stuff to it. And then you have non-keratinized, so without keratin, and stratified squamous epithelia, and they protect against abrasion but not against dehydration. And these are found in the oral cavity, it's inside your mouth, the pharynx, the back of the throat, the esophagus, which is the tube down to the stomach, the anus, which is where you poop, and the vagina, which is where the baby comes out. 2402, we'll have more conversations about that. And the keratin is the protein in the skin cells that kills them and dries them out. So let's talk about some of the difference between keratinized and non-keratinized stratified squamous epithelium. Stratified, of course, means layers, and squamous, and you can see this bottom layer of the stratified squamous epithelium is clearly not squamous. It's not flat. It's clearly cuboidal. But the tissue is named for the shape of the apical layers, the superficial layers. And these are flat layers at the surface. So it is a squamous epithelium, even though it's clearly cuby here at the bottom, the basal surface. So there are, with many viruses, like the flu, fomite transmission, where the virus lives outside of the body on a surface. And so if you're walking into a classroom and you touch the doorknob, and somebody from the previous group had the flu, and they were coughing and sneezing and rubbing their eyes and picking their nose, and they're all contagious because you are a fomite, your hands, yeah, all of you, and they touched that doorknob. That flu virus is still alive on that doorknob when you touch the doorknob. So say you then rub your arm. What happens? Nothing, unless you have an open wound, because your keratinized stratified squamous epithelium protects you. The keratin kills the cells. If you can see it, it's dead. Same with hair. Not the eyeballs. But for the skin, if you can see it, it's dead, generally. Unless it's brand new baby skin, and then it might not be. Regardless, these skin cells keep the virus out and keep your blood in. What about your mucous membranes, your eyes, your nose, your mouth, other places that you shouldn't touch while you're out in public? These are non-keratinized stratified squamous epithelia. That means these cells are alive. And so if you touch a dirty doorknob and then mess with your contacts or pick your nose or pick something up from in between your teeth, then you are exposing yourself to that virus. Now, we are recording this during Corona times. So what does this mean for coronavirus? There is some fomite transmission for the coronavirus, but it does not live on surfaces as long as a flu virus would. They are now talking about some transmission through frozen foods, that coronavirus can live in the freezer, in the frozen foods. So there is some concern with frozen food transmission. But the fomite transmission that they thought was one of the main transmissions when Corona first happened and all of us scrubbing our groceries down, and it's not as big a risk as they originally thought. So what does happen with the coronavirus is it is in the particulates. So in the large things that come out of your face, coughs and sneezes and singing and yelling and those things that spit out. Now for the larger, the bits, coughs, these are like projectiles and they fall. Like if you throw a wadded up piece of paper, it'll fall. And that's where they got this 6 feet away and wear a mask thing. And the 6 feet away thing does help, but now they're finding that it is actually in the aerosols that are in the air around people, especially in low ventilation. Outside, not so much, because there's enough air to diffuse it out that outside transmission rates are pretty low, as long as you stay 6 feet apart and don't talk for more than 5-10 minutes, 15 max. And so now they're finding that inside buildings with low ventilation, where people are more than 6 feet together for more than 15 minutes, that it's literally in the air and that the whole room can be filled with the virus in the air. So outside is less risky than inside. 6 feet away is less risky than close contact. Contact for less than 15 minutes is less risky than contact for more than 15 minutes. When you're not yelling or singing or screaming or talking increases the virus in the air by 10 times, singing and yelling more than that. So one of the riskiest things you can do during Corona times is be inside a building in close contact with other people, speaking and singing and yelling. So don't do that. The grocery store is actually fairly low risk as long as everyone is masked, everyone is 6 feet apart, and you're not standing there talking to somebody for more than 15 minutes. That's when it gets risky. Okay, so keratinized stratified squamous epithelium protects you, but if you touch a contagious fomite and then touch your non-keratinized stratified squamous epithelia, then you have been exposed. And there's also such a thing as viral load, where you have to be in contact with a certain amount of the virus before you get sick with it. And that's different for each person and each virus, and it depends on your the health of your immune system. So that's a thing. So what is keratin? Back to the Noteset. It's the protein in the skin cells that kills them and dries them out. So moral of the story, protect your mucous membranes. Again, so you can write it down. Protect your mucous membranes. Okay. No, I'm just trying to be funny. But protect your mucous membranes. Have we talked about condoms? Protect your mucous membranes. Ooh, name that tissue. That's right. This is simple cuboidal epithelium. I have to click the arrow, don't I? Functions: absorption, secretion, and limited protection, and you find it lining the kidney tubules. And because they are lining little tubules, you often see them as circles. So this line around the outside of the circle, let me draw it in blue for you because it tends to be blue on the slide. So the line around the outside of the tube is the basement membrane, and surrounding that is connective tissue. Okay, and next is one that is not a lab term. So if you put this on lab, it is wrong because this is not in your lab booklet. If it's not in your lab booklet, I grabbed the wrong one. If it's not in your lab booklet, it's a wrong answer on the lab test. So we are studying this one for lecture. It could be a right answer on the lecture test, but this is 100% a wrong answer on the lab test. Not on the lab list, then it is not a right answer on the lab test. So this is stratified cuboidal epithelia. These are rare. They do protection, absorption, and secretion, and they're found in the ducts of some sweat glands and the mammary glands. And the drawing is the same, except there's 2 layers of cells, and they are rare. Next is the transitional epithelium, also not a lab term. Transitional epithelium stretches and recoils without damage. I used to always pull out a rubber band. Invariably, my rubber bands would snap and undergo damage. So they're found lining the urinary system. So this transitional epithelium is why you're able to pee and have an empty bladder, but then like have to pee and have a full bladder. Not that big, but you get the idea. And so here's what it looks like relaxed and then stretched out, and you can see that there are lots of layers, and they're kind of wonky layers so that they can stretch out so that you can have a full bladder and store more urine. So that's why. Ooh, name that tissue. Simple columnar epithelium. Functions, absorption, and secretion. They line the stomach and the intestine. We talked about the microvilli are a brush border. And here's your picture. This is what your microvilli brush border looks like on the slide. And pseudostratified ciliated columnar epithelium are my very favorite to say because pseudostratified ciliated columnar epithelium. I mean, come on, y'all. What could be more fun to say? So what the heck does that mean? Pseudo means false. Strata are layers. So stratified is layered. So falsely layered. So it looks layered, but it's not layered. So here's how that works. The nuclei are at different layers, so it looks like a layered epithelium. But if you follow each cell, and of course we can't follow each and every cell because we'd have to kind of dissect it for that, but they are all touching the basement membrane. And since each cell touches the basement membrane, they're not actually layered. So pseudostratified. And they're ciliated because they have motile cilia. And they're columnar because they're taller than they are wide, like columns. And we're talking about epithelia now. So pseudostratified ciliated columnar epithelia. They give you protection, secretion, they move mucus across the cell surface, which is what cilia do. And they're found in the respiratory and reproductive tracts. Didn't we just say something about respiratory and reproductive tracts? Oh yeah, it was cilia. You find motile cilia in the respiratory and reproductive tracts. Oh look, it's ciliated. It's in the respiratory and reproductive tracts. Oh, sorry, this is page 5. Let's finish up with these tissues, and then we will call it a day on this video. So we talked about the simple columnar epithelium. We talked about the pseudostratified ciliated columnar epithelium. Is the pseudostratified ciliated columnar epithelium actually stratified? No. It just looks like it. Every cell touches the cell membrane. It's the fact that the nuclei are layered that makes it look layered. Okay, and then we have stratified columnar epithelium, also a wrong answer on the lab test. It could be a correct answer on the lecture test, but not lab. And the only function here is protection. This is found in the pharynx, which is the back of the throat, the epiglottis, which is the little flap that keeps your food and water from going into your lungs, the anus, which is where you poop, and the urethra, which is where you pee. And these are rare, so only found in these locations. All right, well, this has been ANP 1, Lecture Test 2, Video 2, wherein we discussed protecting your mucous membranes. We started on the very bottom of Noteset page 3 and went through Noteset page 5. So we will start in the middle of Noteset page 5 with Video 3. Thank you as always for tuning in. It's good to virtually see you here. The education must go on. Dr. J out.